Good morning. Welcome to another edition of, well, it's not another edition, it's just a show. Listen, a lot of people are talking about this being a hoax. It's quite troublesome. I don't think people are dying, right? That's not a hoax. Now, do you have the right to ask questions? Well, I don't know if you have the right to, but you ought to have the right if you don't. I mean, the word right gets thrown around a lot, and I don't feel like I'm the right person for a legal definition. Should you question authority? Absolutely. Should you ask a lot of questions? Yes. And so what I'm seeing lately is, if you ask a question, you're not a patriot. If you're a patriot, you just obey orders. Now, Americans aren't generally that good at obeying orders. I was in the Marine Corps, and Marines are really good at obeying orders, except when they're not. So what is there to do? The most difficult question we're going to ask ourselves in the next 1, 2, 3, 4, and probably 5 years is, did we do the right thing? Did we open up too soon? Did we close too fast? Shutting down businesses? You know, I got some negative comments about it, but I'll reiterate that 10 million people did not get the elective procedures they needed. And elective does not mean non-emergent. Elective does not mean boob jobs. Elective doesn't mean plastic surgery. Elective can have a lot of different meanings in different states. There are dialysis patients that had to wait. There are oncology patients that had to wait. I don't think we want oncology patients and dialysis patients to wait. That's the trouble. The other thing is, can we begin doing interventional pain? Can we begin doing PT? Can we begin doing primary care? Can we begin seeing people in person? Like, those are okay questions to ask. What are the not okay questions to ask? I don't know, because I ask them all and I always get in trouble. So listen, no, it's not a hoax. What's going on, seeing people die, that's not hoaxy. What is hoaxy is not being able to ask questions. Not being able to say, what's the difference here and what's the difference there? And if you stop asking questions because someone gives you shit, well, then you're a weak person. You ought to just be strong enough within yourself to ask whatever questions you want. That's the way this goes. I want people to get back to work. I want people to have the procedures and surgeries they need, whether they're emergency procedures or non-emergency procedures. The one place where we're seeing success is no employer health sponsored plan is going to ever send their patients back to a hospital if they don't need to be there. That's good for us. That's the decentralization of putting physicians back in practices, putting PAs, nurse practitioners, and nurses back in practices and getting them out of the hospitals. Hospitals are for emergencies only. Sick people belong in hospitals. Everybody else belongs inside a doctor's office, a nurse's office, etc. You get the point. This has been Dutch Rojas for another unedited rant. Rojas out.